Good morning. My name is Deborah Zeisman. I'm Executive Director of Hawaii Children's Action Network. And thank you all so much for joining us this morning for our Keiki talk. The topic today is the pandemic and young minds. Keiki talk is our semi-regular series that we have done either in person or now we've been hosting them virtually, where we bring new research, new ideas, hot topics, sometimes from inside our own state and sometimes from outside on the continent or in other countries, to folks in Hawaii for a short talk and then usually some conversations, some Q&A back and forth. So the idea here is to bring new ideas and generate some new thinking. So I am very happy to introduce you this morning to Dr. Jamie Hanson. He is assistant professor in the Department of Psychology at the University of Pittsburgh, and he did his PhD at the University of Wisconsin-Madison, where he combined information from the fields of child development, biology, education, and clinical psychology. His area of expertise is in understanding how children and adolescents learn about their environment, how the brain circuitry involved with learning may be impacted by stressful experiences, what we'll be talking about today, and how the brain changes may confer risks for negative outcomes. I do want to give a special thanks to Ready Nation's Brain Science Speakers Bureau, who helped us facilitate Dr. Hanson's presentation today. They're a great group if you want to check them out. And the format for today, as you can see, we are recording. As I just told Dr. Hanson, we have about 60 people joining us live today, which is wonderful, but well over 100 other people who are direct service providers, childcare providers who wanted to see this talk, but this time does not work because they're working with children and families. And so there was a huge ask that we record today's and share it out later on so that they can see this important conversation. So we are recording, just so you know. The format today will be, I'll be handing it over to Dr. Hanson. He will do his presentation, and we do really encourage Q&A. So we'll have a sizable chunk of time at the end for conversation and questions and answers. So while he is speaking, please put any questions that you would like to ask. There's a Q&A button at the bottom, and then Ryan on our team will be facilitating the questions at the end. So without further ado, I'm happy to turn it over to Dr. Hanson.
Thank you so much, Deborah, for that kind introduction. And we're going to see how well my internet holds up. But I'm really excited to be here and to share some of the things we're learning about child development in the brain. And I'm going to focus a good bit on the COVID-19 pandemic and how that has really exacerbated inequality and potentially impacted families and youth. And there's a couple things. I know there's already been some Q&A about the impacts of COVID. I have some things at the end of the presentation that will really kind of go into that. But I thought I would first just kind of start with a broad overview and a kind of roadmap of what we're going to talk about today. So the talk will have kind of three big sections and then a little bit of Q&A. And the talk basically breaks down into a piece about brain development and the impacts of early adversity. We're going to talk a little bit about economic precarity and the COVID pandemic. We're going to talk about the importance of early intervention and how positive experiences, I think a lot about folks doing direct service and work with families, how that may influence child development potentially for decades to come. And then we'll have this Q&A part. And honestly, that's the kind of thing that I find the most interesting. And so I'll try and kind of give good coverage to all these first three pieces, but then I'd love to hear kind of what folks are really wondering about and what I can kind of use my expertise to kind of inform about. So first, we're just going to talk about brain development and the impacts of early adversity. Some of this might be a review for folks, but I just wanted to kind of touch on it just so that we all kind of have the same basic understanding. And I actually wanted to kind of use a very funny analogy or a very funny bit of symbolism, which is that of a blueberry. What we're starting to learn is that brain development is massive. In the first few days after birth, the brain, the infant brain, is actually increasing by about 1% every day. So every day of a child's life postnatally, up until the first couple of months, it's increasing about the size of a blueberry. And so that has hundreds of thousands of cells and connections in the brain that are growing and expanding. And this is a graph by Dominic Holland and colleagues at the University of California at San Diego, kind of showing that on the horizontal axis is the number of days postnatally. So we get it out to about 3 months, and the actual kind of growth per day. And so this is a really striking amount of change that's happening. The adult brain does not get anywhere near this over decades of time, really. And brain development is wildly large early in development in infancy, but it doesn't stop there. It keeps going throughout life. Especially, we see a lot of brain development in childhood and adolescence. Again, most folks are probably familiar with this, but I just wanted to kind of get us all on the same page. So this is work from a guy named Jay Geed and colleagues at the National Institute of Mental Health. They followed a large sample of youth longitudinally, so they took multiple pictures of their brain over years and years of time. And on the horizontal axis, you see age in years, in contrast to the last slide that had age in days, and volume, the size, the broad size of the frontal lobe, a brain region involved with controlling behavior, thinking about thinking, judgment, planning, these kind of complex aspects of our lives. And what we see is that there's a really significant increase in the volume. You can think about it almost like a muscle. The brain, this really important brain region for controlling our impulses and actions, controlling and regulating our emotions, gets bigger and bigger in childhood. And then it actually hits it's a peak in puberty, where it kind of hits a max volume. And there's lines for boys and girls because they have slightly different sizes of their brains. But then when you go into the post-puberty and kind of early teen years, the volumes actually decrease. It's an interesting phenomenon I'll talk about in a second. And the volumes continue to reduce in the teen and early adult years. And you might be kind of wondering at this point, why is that? Your brain's growing and then it's getting actually smaller in some form. Again, to think of some simple and just easy to grasp analogies, the basic trajectory kind of works like this. Early in development, you have a lot of behavioral flexibility. Your brain is growing so that you can get new skills, different skills, learn lots of unique things. But then later in time, in adolescence and the kind of early adult years, you want to really start to specialize. You want to get good at a few specific things. And so your brain is basically built or has this basic blueprint where you're able to initially gain skills. You can think about learning languages, learning about the context and the spaces you may be in. But then over time, you learn to actually harness and use those skills and use your environment, use the languages you're learning, and kind of use them to your advantage in a really specialized way. But one really important thing to note is that this is a broad set of programs in terms of the brain changing and a broad set of trajectories, but experience in the environment can shape and alter these trajectories. So here's actually some examples from non-human animal work. Some of my research is informed by studies in mice, rats, and non-human primates. And so this is actually work in rodents where they had rats in what I would just call standard housing. One could potentially say it was slightly impoverished or really reduced housing where it wasn't a lot of kind of interesting things. There wasn't a lot of enrichment or kind of unique things to play with for the rats and the mice. And what I'm going to show you is actually a couple of microscopy images that actually are showing the numbers of cells and the complexity of those cells. And with standard housing, there's these little black dots on this image. This is in a brain region called the hippocampus. And what you can see is there's a few black cells, black labeled cells right there. And a drawing of the kind of complexity of those cells is also shown here. And they compared those animals raised in this kind of quote unquote standard housing. Again, you could think of it almost as a slightly deprived housing with those from enriched housing. So these are kind of cool cages, rich places for animals to play, lots of balls, tubes, interesting kind of things for them to explore in their environment. And what you can see in the image with the numbers of cells labeled in black is there's a massive difference in the number of cells And then on the other side is actually the complexity of those cells. So with experience and with enriched environments, we have more cells in our brains being generated, and those cells often being more complex in nature. And so what we know is that the brain is basically plastic. It has the ability to change and grow over time. But we can think about that plasticity is not limitless and has important developmental considerations. So here's a graph that some folks at Ready Nation have made that kind of really kind of summarizes a massive amount of neuroscience work, which is basically that the brain's ability to change in response to experience is particularly high early in development, as shown by this kind of more teal kind of graph. And so you can think about that blueberry, that baby brain expanding by 1% every day is when the brain is almost at its most maximal ability to change. And the other thing kind of happening in this graph is the amount of effort to actually cause a change increases over time and sadly requires more and more as we age. So I think about learning a language or using technology and how children and youth are often incredibly knowledgeable, can pick up words and phrases with just little bits of exposure. But someone who might be older, it's harder to learn a language in your 50s versus when you're 5. It's also harder, and maybe many can relate to technology. My 4-year-old at this point can navigate to things on my phone and on an iPad that probably my mother-in-law who's in her early 70s couldn't. And so this is really where my research is focused, how the brain's ability to change is influenced by these kinds of experiences. And in particular, I've really focused on what many may know now and what we were kind of just calling adverse childhood experience, or the ACEs. So to give kind of just, again, a quick kind of note about this, these adverse childhood experiences encompass many different things. These include really harsh family climates, suffering physical, emotional, or sexual abuse. They include having a parent with a severe mental health problem, having parents that are incarcerated, things like that. And what this slide is really illustrating is that in the yellow and in the darker greens are the prevalences of having these kinds of experiences. And what we're starting to realize is that these are very sadly very common. Again, many folks who are working with children and families may know this and see this on the front lines, but most families are actually suffering a lot of these difficulties. And that's actually much more the rule than the exception. Work has found that only about 1/3 of families don't have any of these kinds of experiences. And 2/3 of kids at some point in development will have one of these really difficult things, sometimes many of them, that starts to really influence development. And again, summating a lot of different research, what we've started to realize is that these early childhood experiences, these adverse childhood experiences, have really long-lasting effects on health and behavior and just life potential and well-being. So if you have suffered physical abuse, neglect, have a parent with a severe mental health problem or a drug issue, you're much more likely to be depressed, anxious, and even things that you wouldn't expect. Your likelihood of having a stroke, a heart attack, and diabetes is actually increased. And so across this kind of body of work, we continually see that these adverse childhood experiences have these long-lasting and negative effects on just a host of our functions. And we can go back to this kind of graph I made about brain development, and basically I call these adverse childhood experiences a form of toxic stress, a thing that just overwhelms our ability to cope, a child's ability to cope. And causes a massive cascade of physiological changes, a lot of negative cognitions, you kind of name it. And these toxic stressors start to impinge upon the basic trajectory of brain development, potentially influencing the flexibility and specialization that the brain is trying to develop over time. So that was all just to kind of get us on the same page. And we can think about, just to kind of recap that basic section, the brain really develops pretty massively postnatally. You can think about and use that blueberry for this really early in time moment, right after birth, those first few postnatal days. But this happens throughout and into kind of the early adult years. This development is really related to experience, but this plasticity and the ability for the brain to change lessens over time. In child adversity, these adverse childhood experiences, these ACEs, may be particularly influential in this development, impinging upon a lot of core neurobiological and physiological processes that then may reverberate for years afterwards. A lot of the work I've talked about basically asks people, in their 40s and 50s, what they remember about their childhood, and they see those associations. But if you track families prospectively, you see the same kind of connections where decades later, someone's risk for these physical and mental health challenges are increased after these kinds of difficult things. So that's all to just kind of get us on the same page. And now I wanted to kind of bring into focus the pandemic, and I think about the kind of precarity that this has created, especially economic precarity with many families. So we can think about the brain is developing, experience really matters, and COVID has impacted us all. I'm talking to you from a computer screen and have been teaching classes at the University of Pittsburgh this way for the last year and a half. So clearly my life is different, your life is different, but it really hasn't impacted us all in the same way and equally. Here's kind of a recent piece from Bloomberg kind of talking about the devastating inequality that may be reverberating because of COVID for years. And so I just wanted to kind of illustrate that in a couple different ways, because I think it kind of sets the stage for child and youth development, since they're nested within families and the financial circumstances of families really matter. So at the basic level, unemployment pre and post the pandemic has been wildly different for different people. There's unemployment rates listed here for white, Hispanic, and Black Americans pre the pandemic and post the pandemic. And like I think many would have guessed, sadly, people of color are disproportionately affected by the pandemic, and that just creates more economic precarity for those families. Interestingly, if you really zoom in or you zoom out across the country, there's some really interesting data looking at income inequality at a county by county level. So taking your specific county and how much inequality was there and just kind of the span of incomes and wealth. And looked at the rates of COVID cases. And not surprisingly, there's a fairly strong connection between income inequality and COVID cases. And these authors were really arguing that economic inequality really kind of led to more risk and more challenge for many families. Many families weren't able to kind of avoid work or have different kinds of precautions or privileged lives that the more affluent folks in the world were. So we can think about there's this kind of inherent connection between COVID and income inequality and all these economic circumstances that we may not initially kind of our brains may not jump to. But I think the data is starting to come out and be really compelling that economic circumstances and the impacts of COVID are not equally distributed. And it's something I think we need to think about as we start to emerge out of the pandemic and think about a post-pandemic future. And to drill into this a little bit more, some folks have done some really beautiful work kind of tracking multiple forms of economic precarity for different demographic groups and what it looked like pre and post the pandemic. And so this is an interesting graph that I'll try and walk through. It basically looks at housing insecurity, not having a kind of consistent residence, food insecurity, so not having kind of fresh fruits and vegetables, which is not even having the ability to kind of often have whole meals and just kind of consistent meals, financial insecurity, worrying about things like rent and different kinds of expenditures in your life, and whether you actually have just the last part of the graph is about being fired or losing your job. And in addition to the kind of racial disparities, we start to see some other sociodemographic disparities where those individuals and those families where the caregivers have lower education are often more disproportionately impacted. And so basically the places with the little stars indicate a really significant and massive uptick in this kind of insecurity for that demographic group pre and post the pandemic. So folks who have less than a high school education had increases basically in housing insecurity, food insecurity, financial insecurity, and have a greater likelihood of being fired or unemployed pre-post the pandemic. So again, we can think about these things aren't universally distributed. And connected to this, a big piece of my recent research is expanding our notion of risk. So we think a lot, and I've done a lot of work about poverty and the impacts of poverty and lower socioeconomic status, lower household income, and how it may shape the brain and behavior. But we kind of define poverty and economic marginalization in, I think, a really kind of single-minded and kind of small scope. And I think it's time, and I want to just kind of have a little bit more data that I'll show you here to think about expansion of our definition of risk. So this is work from the Consumer Financial Survey, asking people about different kinds of difficulties they've had in terms of affording food, being behind in rent or mortgage, having utilities being cut off, and being overcrowded, having housing overcrowding. And the colors, the blue colors, indicate the amount above the poverty line. And so many federal programs and different kinds of social safety nets really just focus on the darkest blue colors. So families and households that are at the poverty line, about $24,000 for a family of four. And at best, they kind of get it to 1 to 2 times the poverty line. There's some expansion with the new child tax credit. But what you can see through this graph is there are many families that are 3 to 4 times the poverty line. So they're making $60,000, $70,000 a year, but they're still having some challenges and difficulties with these basic elements of security. And so our team at University of Pittsburgh has been really interested in working with families to try and understand a little bit more about the lived experiences of their lives and the really kind of day-to-day and month-to-month variability of families. And we've found some really interesting and compelling data that I'll just kind of talk about, some related work, and I have a little vignette of right now, which is and many in direct service with families may know this, but we often talk about and think about economic precarity and these different forms of social safety nets applying to people at the poverty line. And that's an aggregation of income across time, across a whole year. But many folks may realize and may know that income isn't just like a spigot you turn on and it just comes out of the water comes out of the faucet. Income may ebb and flow in different ways. And at this point, we're not taking any consideration into that. And we're also not thinking of, as the pandemic ebbs and flows, there may be a lot of challenge that families are experiencing, though they may have, not on paper, qualify or be at the federal poverty line. Their incomes may move up and down quite a bit month to month. And so this is actually some graphics from the New York Times and JP Morgan Chase that actually ask people about their monthly income. And what this graph really shows you, I'll just explain it for 1 second, is on the horizontal axis is the annual income of people and individuals and families. And so there's greater values as you go to the right of the screen. And on the vertical axis is the average amount of change happening with income month to month. And so basically, there are many families that are having a massive swing in income, 20 to 30 to 40% month to month. And you can start to think about the kind of psychological challenge that may create, even if you are not at or near the poverty line. If you are involved with seasonal work, gig work, have unsecured work, but in the aggregate, you may make $50,000 a year, but that may come in these drastic swings. And I think a lot about families and how stressful that is on them and how that then cascades to youth. So to kind of start to tie all this together through some adaptation of other research, we have been thinking a lot about how multiple forms of economic circumstance come together. Things like familial wealth. This has kind of been, I think, a big thing that people have talked about, especially after the kind of ProPublica expose about generational wealth. But there's also ideas of income level. So some people have greater income, some people have less. We use the federal poverty line. But then also income volatility. And we may need to think about all of these circumstances coming together and how that may create poorer economic circumstance, poorer kind of more economic marginalization for families. And how over time, a lot of research underscores that with greater economic challenge, you have greater parental distress. So we can all kind of intuitively think about this. Your family is worried about bills. You as a parent then start to have more negative affect. You start to worry more about money. You start to potentially fight or have conflict with your spouse. And that could come regardless of if you're at or below the poverty line. If money is kind of really lean this month because of seasonal work, you may then have just more and more conflict in your family. And as you as a parent gets more and more distressed and has more negative affect and stress, there's a lot of good work to suggest that this is really going to start to influence and impact parenting style. So the actual ways that parents are interacting with their kids, they often show a little bit less warmth, a little bit less connectedness with their kids, and often are a little bit more harsh in some of their disciplinary practices and kind of interactions with kids. So we can think about, again, the pandemic may impinge upon multiple forms of these processes that may ultimately then kind of cause youth to have different kinds of behavioral problems. We kind of know as parents are less warm and more harsh, kids often have more behavioral issues. The other thing that I'd be just remiss if I didn't at least mention is we're starting to try and think about, especially with kids that are a little bit older, especially think about like kind of in the teen years, are teens embedding and thinking about that? Are they picking up about what's happening at home, about whether mom and dad are an essential worker and have to go into work? And so we're trying to think about how youth processes may then also contribute to behavioral challenges. So I'm mindful of time and I really want to get to folks' Q&A. So I'll kind of run through this last little bit to just say, we know that the COVID pandemic really reshaped society, but this didn't really affect all equally. There's a lot of kind of data to suggest that many are living in pretty precarious ways with increases in housing, food, and financial insecurity. And that we may need to expand our definition of risks. And service providers, it would be great to think about this larger lens because families may be under a lot of stress, but they may not meet the exact poverty guidelines of a state or a county. And that over time, we should start to think about these fluctuations in a bit more micro level in terms of monthly income and how this they then may cascade to family stress and family stress processes. So the last little bit is maybe just to give a little bit more of a kind of glimmer of hope. Since I've talked about a lot of negative experiences and how stress and those things may impact development in youth, I wanted to just kind of give a few kind of notable examples of positive experiences and pretty significant and well-studied interventions that have found really positive and buffering impacts on at-risk youth. So a couple kind of quick notable examples are the Plasticity project in North Carolina, and the Perry Preschool project in Ypsilanti, Michigan, as well as the kind of nurse-family partnerships that have been kind of all around the country. But just a kind of quick note about, we're seeing a lot of long-term effects on behavior and the brain with these kinds of interventions. Just a quick example from Plasticity, which is basically an early infancy kind of young childhood program where participants received childcare and did a lot of educational activities that were kind of games-based and emphasizing language. They did this again between infancy to about 5 years of age. And then people looked at their outcomes for the kind of following basically 30 years. And what you'll see, the intervention group is in red, the control group who just kind of got some basic information about these services but didn't get them are in blue. And the intervention group has lower rates of special ed, better percentile achievement, greater likelihood of high school graduation, and then really going very far out, they're more likely to earn more wages per month, own a home, never be on welfare, less likely to actually go to jail or be incarcerated in some form. And so there's these big payoffs. This is 20, 30 years after these interventions happened. And people are, some colleagues at the University of Pennsylvania actually have found that this intervention actually results in pretty large and statistically significant changes in brain structures. Again, the intervention stopped at about 5, and these brain scans were acquired at about 40. And so I'll kind of gloss over some of this, but what we're realizing is that many of these really high quality programs have massive returns on investment. So it's a really good thing if we invest in kids and families early in development, because it often yields back a massive amount of dollars from a purely economic perspective. I'm mindful of time, so I'll cut back a few things and just try to give some tangible feedback and tangible kind of things to think about. So in terms of thinking about quality programming, we want to have rich interactions with professionals and the youth that they serve. We want kind of warm and caring environments where you're trying to kind of think about a family structure, their culture. We want to kind of adapt to youth and families in need. And I think this is goes back to the precarity piece, where families' lives may be more complicated and complex than meets the eye. And so I think we want to be sensitive and thoughtful in that space when we can. Consistent daily routines seem to be incredibly useful, especially if there's a lot of challenge and chaos at home and unpredictability. Having a childcare setting where there's just a hard routine, I think really helps, and we're starting to realize has a powerful influence on development. Doing things like ongoing assessments and kind of seeing where there may be holes and gaps and where things can be improved is kind of critical. And people talk a lot about this kind of planning and learning cycle. A couple of just kind of quick vignettes of all that. We can think about responsive relationships with kids have a double benefit. They often help with brain development, and they buffer against toxic effects of stress. Many folks may know there's a really famous resilience study on Kauai that looked at resiliency processes, and they found that having one supportive adult really was this massively influential and important thing for children who were struggling and kind of quote unquote at risk. Couple other things is to think about strengthening core skills in life. No one's born with the ability to regulate and have these kinds of executive functioning planning things that we need to do. They develop over time with scaffolding and coaching. And so there may be a way to prioritize activities that kind of help and work with these things. My wife and I do a lot of breathing exercises and calming down kind of self-regulatory activities with our 3.5-year-old. And just kind of having that kind of intentional moment can be something to think about as we work with more families and kids that are facing challenges. And also kind of defining small incremental tangible goals. Last kind of piece is reducing sources of stress and unreliability. So kind of reducing barriers when you can to kind of work with families. And one kind of piece I'll just kind of note is this push on reliability and consistency. And it's one of my kind of favorite studies that I just wanted to highlight really quickly. Many folks may know about the idea of delay of gratification. People have heard of the marshmallow task. It was a very big thing where you take a 4-year-old, you put them down in a lab, you put one marshmallow in front of them, you say to wait 5 minutes, and you can get a second marshmallow. Everyone kind of touts that as delay of gratification is a super important thing you should do. We should all be patient, et cetera, et cetera, et cetera. Some really smart researchers at the University of Rochester said, well, what happens if the kids who are doing this experiment witness a lot of unreliability? So they manipulated before the kids did the marshmallow task, whether the kid could see someone being reliable and delivering on their promises or not. And they found these wildly different effects where if a child had just seen reliability as shown by the white bar, they'll wait 12, 13 minutes for their marshmallow. But if a kid has just witnessed someone be unreliable in front of them, they will wait 3 minutes. And it's very rare in science that you have a graph that is in minutes. So I think about how notable that is. So with that, I'll kind of close up. I have a few kind of Q&As that I think had come up before, but we can think about early interventions, kind of really big impacts on brain and behavior, especially for families at risk. This is seen decades after these interventions. And even if you ignore, I think, the humanistic benefits, there are these major economic returns. So regardless of your political persuasion, you can think about these things make sense. So a few things had come in on the Q&A before this. Some folks had asked about whether COVID might impact emotional processing because you have a lot of people wearing masks. So some colleagues at the University of Wisconsin, Madison, where I actually did my PhD, they looked at how kids are processing faces with masks or as a kind of control to have sunglasses on them. And what they find is any kind of some occlusion of the face does impact emotional processing. If you have a mask or sunglasses on, you're not able to pick up as much emotional information. And if you don't have anything on the face, that's this kind of yellowish, beigeish line. But the other thing where your face is being covered impacts some of your emotion processing. Notably, you use lots of different aspects of the face to understand emotion, both aspects of the eyes and then kind of the mouth. So there's still information coming in. So I think the jury is still out whether there will be long-lasting impacts, but that's something to just think about and consider. The other thing, folks asked a little bit about language and what we're starting to realize, or there was a question basically about whether masks being on kids could impact, or others could impact language processing and language learning. And some recent work actually found that it's kind of not exactly the story that I think this questioner was asking about. It's not, the pandemic, it may be impacting language, but it's not through the seclusion of speech. It actually may be that kids are using screens more. And so basically these researchers across a couple of different countries, about 7,000 people, I think, charted pre and post lockdown vocab development. And they found that kids who had more screen exposure during the pandemic had smaller gains in vocabulary. So it's not necessarily about mask usage. It may be more about burnt out or just emotionally taxed caregivers and families using screens more because a lot of people are kind of at their wit's end. I know that happened a lot early in the pandemic with my wife and I. I think one thing is that there's a lot of plasticity in the brain and there's a lot of ability to catch up. So that's something that I don't think we have to be too concerned about. But one thing that I don't think came up is really thinking about social interactions. So there's a little bit of question about emotion, but I think about kids sitting on a Zoom screen and that being their 9 to 5 or 8 to 3, depending on what your school day is like, compared to what normal school playground interactions are. And I've gone to the playgrounds with my 3.5-year-old a bunch, and I just kind of see this aching and yearning, I think, in so many kids that are school age that don't have social interactions happening. And so I think we'll need to think about ways to help kind of kids catch up on the social interactivity that they missed during the pandemic. And that might be something that we can really start to brainstorm or think about as folks, aiming to cultivate well-being in youth. And so with that, I'll kind of thank you, and we can kind of start to jump more into the actual Q&A and see what's kind of on your mind and if things I was talking about made sense. So with that, we'll open it up.
Well, thanks, Dr. Hanson, for such a thorough presentation, and thanks for covering some of the questions that already came in. We had a couple that have been coming in throughout the talk. First one was, will the experience of the pandemic count as an adverse childhood experience for all that have lived through it? And will we see an increase in adverse childhood experience scores due to the pandemic if there is another study done?
So this is a really good question. And it's really, to be honest, the devils are in the details, and it's important to be nuanced. So the people who talk about the ACEs a lot talk about concepts of positive versus tolerable versus toxic stress. So if you are being physically abused or neglected, sexually abused, or emotionally put down at home, it's really hard to cope with those kinds of experiences and have any kind of mastery or feel like someone is there to support you. So those are clearly ACEs. With the pandemic, many families may be functioning in lots of different ways. And there may be many families that have had an increase in conflict. Parents may be stressed out and bringing that home, especially if they're an essential worker and kind of worried and anxious about exposure to COVID, things like that. So it's not necessarily that the pandemic is going to be an ACE and we're all kind of a +1. I think it depends on how the pandemic actually influenced families. And in many ways, I think as long as people were having kind of honest, age-appropriate conversations trying to explain stuff to kids, that's probably a way to fend off or to at least lessen the potential of challenge. And so we even try to talk to our 3.5-year-old. We're like, here's why you have to wear a mask. Here's about the virus. And this is kind of going to change parts of our lives, but it's not going to be forever. And we're going to try and protect you. That becomes more complicated if you're an essential worker working at a grocery store or in a hospital. And it may be harder to kind of, assure your kids that everything's going to be all right when you yourself may not be so sure. But I think the idea is to try to have support, get kids to kind of tackle and think about the challenges at an age appropriate level and know that they're going to be supported and cared for, even if it is a big change in routine, even if parents are stressed out. The more that we can focus on that, I think the less likely there'll be detrimental effects of COVID's large societal influence. So.
Great. Another question, can you talk more about the concept of reliability and how that affects childhood development? Is it related to any adverse effects of instant gratification? For example, if a toddler insists on watching a video on the computer and is always granted that, is that negative reliability?
So this is a really interesting question. And I think of it a little bit more from a learning perspective. So there's a really famous quote by William James, who's a psychologist from the 18th century, and he talks about the world being a blooming, buzzing confusion. And I think about an infant trying to make sense of the world. Why is someone doing this? What is happening here? Especially when you may have limited visual and cognitive resources. Really small infants have just horrible vision. They can't even really see very well. And so you have to make sense of the world and what's going on inside of it. And I think the more that you have kind of pairings between some kind of signal of something and an outcome, the better. That's a pretty kind of small scale psychologist version of that. But I think as we scale up, the more that kids can understand rules, and even thinking about context that they live in. You can do this here, you can do this at grandma's, you can do this at school, and we have different sets of rules. But as they start to grasp that there are different contexts and there's different rules within those contexts, which help the world kind of have a structure, I think that often facilitates learning. In terms of when we get something in and at what schedule, people have been researching different elements of social media usage. And I think it's clear that having such maybe an instantaneous connection to content and in very engaging videos and video games and things like that may sometimes be detrimental. But I think it may be less detrimental than we potentially think. One thing I think that we should be mindful of is how people are using social media and just screens and media in general. And I think there can be lots of positive things in that space. Again, thinking about the pandemic, lots of people were able to connect with remote devices and remote video conferencing and things like that. And so there are parts where this is good. And again, I go back to the youth who don't have social interactivity in a direct school setting. There might be a moment where playing Minecraft or something like that is actually a useful social connection, even if it is non-ideal. And it might be, a reasonable, a moment to just say, okay, I don't love these video games, but if this is a way for my kid to have some social connection with others, we'll set some time limits, but that could actually be socially promotive and useful for development. So I think with lots of things, it's all about kind of moderation and not overdoing it. And patience is a tough virtue to, I think, instill in all of us. But I think having tangible, small scale, very kind of incremental bits of reward for waiting can be a useful thing as we kind of learn and think about scaffolding up to more complex bits of environmental structure and consistency. So hopefully that got at some of the questioners' kind of wonders. So.
Mm-hmm. There's just some discussion about the concept you mentioned of catching up. One person said, maybe children don't really need to catch up since everyone went through the pandemic. And someone else responded, that the notion of catching up is important and takes advantage of neuroplasticity. And, one challenge might be providing enriching experiences to those at risk. So is that sort of how you meant catching up? And was it more comparing children to their peers versus like a set of criteria, how they should be doing at this age or grade?
Well, so I think there's a lot there to unpack, but what I would say is, I again would go, all children are not equally affected. At least in Pittsburgh, the private schools, they're all open and in person, and those kids are having few decrements compared to the public school kids who have been remote and have had lots of interruptions. And the private schools cost a great deal of money, and so it's already, I think, privilege begetting privilege, and complex and challenging. So I think that there will be many times where there will be disparities because of educational experiences that are happening for folks. But I think the idea of catch up is, maybe, you can think about kids gain certain numbers of vocabulary words and kind of understand certain kind of semantic and linguistic concepts. They may do it at certain milestones, but there may be points where they kind of are maybe slower because of the pandemic, but then they have acceleration at other points. And so there may be these kind of more complex trajectories that we will need to think about and process. But I would say comparison, there are many forms of comparisons, both historically, the kind of, I think, the well-off and the less well-off. And then I think there's also global comparison. So again, kids in different countries didn't necessarily experience the same levels of closure as they did, or certain countries didn't have their schools shut down. I have family in London, and their schools were primarily open for a lot of the pandemic because that's what that country thought best. So there will be different kinds of disparities happening, and I think it will be imperative that those trying to support youth do think about those kinds of experiences for enrichment, because I don't see a lot of drawbacks or downfalls. If there are kind of reasonable resources, abilities to get families and kids to places where they may get these enriching experiences, it's kind of a win-win if the infrastructure is there and the means are there. So I think that those could be really powerful things to help alleviate any potential differences. And it's hard because we may not know all the differences for years to come. And so it's a little bit, not to reuse this word, but we may be playing catch up to understand the impacts of things. And so it's better, I think, to be inoculative and preventative in that form and just kind of, invest heavily, because it's better to invest now and try and help kids support their development than 10 years down the line realize that, oh no, it actually had a pretty substantial effect on kids. And now you're probably, it's going to cost you 3, 4, 5, 10 times what it would if you had invested early. At least that's what a lot of the data and research and evaluation about interventions would suggest. So.
Thanks. So we had a question about statistics on the effects of the pandemic on Asians and Pacific Islanders. They wrote, given a significant portion of Americans have scapegoated these groups as the cause of the pandemic, what could be the potential effects on families and their children? And would you recommend any specific therapeutic interventions?
So this is a really interesting question, and actually connects to a different version of a previous question. Many, myself included, have been thinking about whether racial and ethnic discrimination might be an ACE. You can think about being scapegoated, microaggressed, discriminated in large or small ways, maybe something that activates your stress system, causes you to have negative affect and anxiety, and it may be something that we're not really thinking about. So that's one thing. So I think that is a very reasonable suspicion, especially in places where instances of discrimination are more publicized. And I think there's a lot of work also trying to understand whether there may be this like almost vicarious or re-experiencing and televising these things in a way where you can jump on on TikTok or Twitter, and you'll see these things, they're rebroadcast on the news. And is that just re-triggering and just kind of getting people to feel unsafe, even when it's not happening to them? So I think depending on where you live and the likelihood of this racial and ethnic discrimination happening, and then how much media you consume in that space, that definitely could have negative impacts on families and youth. In terms of intervention, I'm not an interventionist, and I'm not a clinical psychologist, so I'll just put that as a big note. But there's been a lot of work thinking about fostering positive racial identity and fostering kind of youth consciousness. And I think depending, you can even do this in fairly young kids, but thinking about, there's a lot of kind of Black boy joy, kind of Black girl magic. I think there's similar things. It's less developed, but I think in the AAPI space, there's kind of just a push towards the beauty of culture and realizing your cultural group and your cultural heritage. And so I think that, like many folks may have seen, there was some Asian American teenagers that were picked on at a San Francisco school, and then they wrote a punk rock song about it, and then they were on Jimmy Kimmel called the Linda Lindas. And so I think there's things like that can be these interesting outlets where youth and families can take some of this, honest tragedy and stress and try to say, these people are ignorant and bigoted, and our culture and heritage is beautiful, and here's some examples of it. And I think celebrating that as one can in age-appropriate ways could be a way to buffer and buttress against some of the, I think, clear discrimination. I think about COVID, and then I think about some of the kind of shootings in the Atlanta area that really kind of had people thinking about different groups of color and how they may be discriminated against. So.
Okay, thanks. I would also mention, just as a side note, that this is an area that HCAN is interested in exploring further and more in further Keiki talks. So if anyone in the audience has suggestions for speakers or people to talk about this topic, let us know after this. We had two questions sort of about strict social distancing or social isolation. What might the impact of that be on young children? And there's also a question about how can we get our schools to better support our kids' mental health in this context?
Yeah, and so this, I think, came up a lot for both youth and families and adults. And, the pandemic has many reverberating impacts. I think a lot about people more in the adult space are talking about what's called deaths of despair. People not feeling like there's a way out, feeling like the odds are stacked against them, and really kind of struggling with that. And I think those things happen in social isolation when you don't have any kind of connectivity, you don't realize that others may be going through similar things, you don't see ways out. In terms of schools and school policy and kind of thinking about COVID restrictions, I think there's at least decent data. I feel like Dr. Fauci would probably agree that transmission outside is relatively low. There's been decent descriptive and quantitative work kind of talking about that and showing that. I think pretty fair that this version, it may get more complicated with virus variants and stuff like that, but just a natural airflow kind of disrupts these things. So a couple things in this space. I think we can think about social interactivity in non-confined settings or just settings that have larger space. So, if you extrapolate out, it's really about air volume. If you have a really big space like a gym, you can maybe have more people in there because there's more airflow and just a larger air volume. And so transmission may be lower. The best would be even doing it out, having social activities and classes and less social distance learning opportunities outside. And again, in private schools, some colleagues in Texas had kind of talked about their school retrofitted a bunch of green space they have to basically be outside classrooms. And so I think we can think creatively with the infrastructural constraints that we have to try to, number one, have these outside opportunities, and then sometimes potentially think about creative ways to reduce social distancing if you're circulating air in enclosed spaces, and just be mindful of what the research is showing. And I think also, depending on the age groups, a lot of kids now 12 and older available, they can be vaccinated. And so again, we can think about pulling back some of the restrictions on different age groups and layering on different opportunities to maybe not make the isolation so brutal. Again, sometimes be creative and don't let the kind of perfect be the enemy of the good, in terms of, no one wants their kids to be playing 12 hours of video games, but if playing an hour of video games allows a kid to feel connected, it might be something that is a little bit more reasonable if a kid is feeling particularly socially isolated. And so trying to think creatively in these different spaces, I think will be useful at home and then also at school. In terms of actual social distancing, I don't know if that necessarily is the walloping factor. I think as long as kids can have some interactivity, but I think kids sitting alone at home, in front of a computer. I have friends who their 6-year-old started kindergarten, or 5-year-old started kindergarten, and I was like, oh my God, that feels like incredibly depressing to have a kindergartner start this first school experience and just be in front of a Zoom screen for hours at a time. And that, as a child developmentalist, kind of broke my heart. And so I think about ways to be creative so that we don't have to get into that space and people aren't totally isolated. And I think now that we know more about the virus and its transmission, that's still evolving, we can maybe think and have more flexibility in what we're doing and how we're structuring activities in school days.
Thanks. So we're coming up on the last minute or so. If we didn't get to your question, if you don't mind, Dr. Hanson, I can send you a couple that we didn't get to, and maybe we can get back to them offline. But just to wrap up, a couple rapid fire questions, and these have been asked a couple different ways. But if you have a key, one key takeaway, one concrete takeaway for a parent or caregiver, what would that be?
I often think about kids know sometimes more than we think, and they pick up on a lot of things that we maybe try to occlude or hide from them. And there are times that we can have difficult and hard conversations in age-appropriate ways, and it may be more useful, at least our kids can maybe grasp and cope with a lot more than we maybe think they can. And so I think sometimes having these difficult conversations can be useful.
In terms of providers, a lot of here are organizational leaders or work with kids. Any concrete or key takeaway for them?
I think about trying to be flexible. Sometimes I think about providers having certain kinds of inclusion criteria. You have to have a certain income level, you have a single parent status, XYZ thing, and thinking about having sometimes more flexibility if the resources are there. So I think that's the biggest thing. That's one thing. And then I think about consistency, almost from just a staffing model. It's a mini aside, but I have a colleague who did a lot of work in the Russian Federation related to their orphanages. And there were pretty severe child deprivation kind of happening and lots of inconsistency occurring with staffing. But this colleague, Bob McCall, kind of reworked things and the structure of they're called sometimes just called baby homes, to be a lot more almost family-like. And so these are, foster settings for kids, and just having more consistent staffing patterns, more kind of kids being able to understand what's going to kind of happen next, was really powerful. It still wasn't as maybe good as the kind of, typical kind of, family structure, but even in those dire consequences, in those dire straits, there were still pretty positive effects when there just was kind of basic consistency and just some individualized attention that could happen in kids being able to kind of grasp what was happening and be able to almost predict that like this was going to go to this and this was how our day was structured. So thinking about kind of having, structure when that can be, when that can happen, resources permitting.
Mm-hmm. Okay, and last question, same question, but for policymakers. And one particular frame on this is, looking at the macro level response to children that have been disproportionately impacted by COVID and the pandemic. Is there any evidence it'd be better public policy to provide direct economic support to families versus providing additional social supports to children?
This is a really interesting question that a lot of economists are kind of looking at, and they're always really interested in these ideas of what's called cash transfer, conditional cash transfer, and it's a very open space. But I think that it's not unreasonable, and there's lots of places that are experimenting with universal basic income. So back in California is this kind of massive space where people are just there's a floor for how much money people have. And I think that can be really powerful, especially, not to harp on this, if it's consistent. The thing that these cash transfer programs kind of, I think there's been mixed evidence, but if families know there's going to be money, that helps them kind of sometimes plan and game out what they're going to do, number one. And sometimes families being able to control and have a little bit more autonomy in what's needed can actually be useful policy. People have lots of different feelings about, oh, a family got their stimulus check, their COVID support check, and they bought a car. But maybe that's a useful thing for the family because maybe that opens up economic opportunities and new jobs that a parent couldn't have taking the bus. And so I think sometimes we should trust families a little bit more and be a little bit more flexible, both with inclusion criteria. I think this idea of precarity and especially people being bumped out of potential social benefits because of kind of some of these arbitrary things is one problematic piece. And then kind of trusting families. Obviously, we don't want waste, fraud, and abuse, but we do, I think, can trust families to sometimes make some informed decisions about what might help them the best and the most, because maybe they don't need X good that is going to get donated to them or given to them. And just having a lump sum transfer could be super useful and open up a bunch of doors in a way that policymakers may not always see or understand. And so I think trusting families and giving them the autonomy to sometimes make these decisions, especially if it's in thoughtful and informed ways, like I think we should do more of. So, and I will be interested to see if this like UBI, this universal basic income, what the kind of child development outcomes are. And Stockton, Pittsburgh is thinking about doing this. There's lots of places around the country that are kind of underscoring or investigating this. And I think this idea of just having less stress, less worry about when is the next check going to come? Am I going to be able to make a car payment? That can unload a lot off of families. And then that can open a lot of doors for them. If you're not worried about what the hell am I going to do on the next rainy day when something goes wrong in my housing arrangement, that can be really powerful. And I don't think we think a lot about the kind of human kind of stress experience and how the bandwidth of people may be, really taken up by these small day-to-day things that if we gave them consistent support, maybe would be alleviated and people could prosper a lot more.
Well, thank you. I think that's a great way to wrap up. Thank you to everyone who stuck with us a couple minutes over 10 o'clock. And thank you so much to Dr. Hanson for a great presentation and a really informative Q&A. Thanks for being here this morning, and we'll see you at the next Keiki Talk.